Morning, everyone. I'm going to talk about the Liverpool Head and Neck Cancer Centre's approach to patient and public involvement in research this morning. My name is Professor Jo Patterson. I am a speech and language therapist by background, and I work at the University of Liverpool. Our PPI group is well established, and it was set up in conjunction with Simon Rogers. So I'm going to tell you a bit more about their work this morning. Firstly, who to involve in your PPI and why? Well, the answer to that question may depend on what knowledge and perspectives you're looking for. But certainly, in terms of PPI, it can improve the quality and relevance of your research, making sure that the right questions are being answered, that research is being carried out in the right way, and that results are shared with the people who need to know about it. And these days, most funders expect and require that PPI work is done in conjunction with your research. Why do it? Well, I think that's really encapsulated by this picture here about there's nothing quite like the user experience to inform what should be done. And here is a quotation from Professor Dame Sally Davis, a previous Chief Medical Officer, that says no matter how complicated the research or how brilliant the researcher is, patients and the public always offer unique, invaluable insights. Especially when designing, implementing and evaluating research, they make studies more effective, credible and often more cost efficient too. Beyond that, I think it's our moral duty in that patients have a right to be able to input into research on their condition, especially those whom are seldom heard groups. It affords a real world experience and it provides both efficiency and value, increasing the relevance to patients, helping with things like recruitment and retention rates and extending the range of people represented in our research studies. It increases the accountability and transparency of our research processes. Here is what we know as the research cycle, and these are all the activities that one might start off with, right through into thinking about how our research is implemented into the real world and everyday clinical practice. But what I'm going to focus on today is just the identifying and prioritizing of research. The group has got plenty of examples of all the other circles, but there's just simply not enough time to be able to cover that. So I'm going to talk through a project which we've recently finished. This is called PPI within Palliative Partners Head and Neck Cancer Subgroup. This is a project that was funded by the National Institute for Health Research, and it was a project that I co-led with Katrina Mayland on the left and Val Bryant, our PPI representative, on the right. I selected this particular project because I know that today we are remembering Professor John Hyatt, who attended these meetings with his wife and really gave such excellent and valuable insights from a patient perspective. This project received funding from the NIHR, and primarily that was because we were trying to address areas of high incidence of head and neck cancer, i.e. that is the Yorkshire, Humber, North East and North West regions of the UK, and really try to understand what the unmet needs might be and what areas of work we needed to focus on research-wise for our palliative patients who were diagnosed with incurable head and neck cancer. What we wanted to do is, first of all, build a network of clinicians and patients who were affected by incurable diagnosis of head and neck cancer before we started to look at a priority setting exercise where it was going to help us focus our next stage of our work. One of the first jobs was to design a leaflet that would be appealing and explicit and inviting for patients and their relatives to come and join our network. So we needed to get the language right. It needed to be put in a sensitive way, and also ensure that people knew that they would be supported both in terms of training and any expenses for their time and travel. So we worked very closely with Val and the PPI group to make sure that the wording and the layout of this leaflet was done appropriately. And this was done in conjunction with our study coordinator, Dr. Michelle Lawton. One of the things that we wanted to do is really encourage people, patients and their relatives, to join the network. And we decided what we would do is offer what we called a buddy system. So this was where we had experienced PPI members, and they would offer one-to-one support for those who are new to research, because we were very aware that it could seem really quite daunting and highfalutin and something not for them. We wanted to try and dispel those myths. And as part of that, we had to identify any support and training needs, and really trying to increase our engagement. This meant that we needed to have really strong working relationships between Michelle, the PPI lead, and the potential PPI representative. So Michelle acted as a linchpin and a coordinator to really support people to become involved in the network. We needed to think about being ultra flexible, because we knew that patients with incurable disease may not be physically or mentally well enough to attend meetings, and may need to cancel at the last minute, and we needed to reassure that that was absolutely fine and understandable. And also we wanted to work with clinicians about approaching potential people at the right time, that was sensitive enough so that we weren't overburdening them or giving them another thing to think about at a time of high stress. But alternatively, there were many people out there that wanted to get involved and wanted to have a say, so we really needed to couch this very, very carefully. Val Bryant is the PPI lead for this network, and Val is incredibly experienced. I've worked with her on several projects now as a PPI lead and co-applicant. She has got personal experience of having been diagnosed with head and neck cancer several years ago, and across that time she leads a group called Change, which is a group of other head and neck cancer patients who want to be involved in planning and helping researchers to conduct appropriate research in this field. She knew that it was challenging to really try and recruit patients with incurable head and neck cancer. She has been disease-free for well over 12 years now. She was involved right from the start of the project, which is important for PPI. It's not appropriate to bring them in halfway through or towards the end of a project. They need to be there right at the very planning stage. But also Val's husband has had head and neck cancer too, so she offers a really unique insight to also being a relative of somebody who has gone through similar treatment. So what we did across the network is that we managed to recruit patients from established head and neck cancer PPI groups. We also managed to draw in a couple of other new members via clinical teams, and also we reached out to other groups, for example, head and neck cancer charities, and managed to get some further representation from them too. Our activity was largely around setting priorities for research, and our PPI representatives, with support, were able to engage with this exercise, which involved really trying to drive some sense of consensus over what the areas of research might be for this particular group to inform our future work. Things that helped along that was Val attended a patient conference called the Swallows, and she was able to disseminate some of the questionnaires that we needed to get feedback on around our research priority setting, and that often is best done in a face-to-face way, with a patient helping to recruit other patients into the study. Her presence was really important to be able to raise that awareness and increase engagement, and also to provide support for those people that didn't really know how to fill those questionnaires in, and needed some of a steer as to how to go about that. And that, probably if it had come from a researcher or a clinician, patients may have felt that they were unable to say exactly what they thought. So it was important that that came from Val and some of her other members of her change group. We've got sweets on the side here because she said that that really helped draw people into her stall where she was giving out some of these questionnaires on the research priority setting exercise. These were the research priorities that we were able to set because of that work. And I'm not going to go through all 12 of them here, but we've grouped them into thinking about, we need better service provision, it needs to be more coordinated, and more training for staff needs to be given. There needs to be more around management of symptoms, helping to improve quality of life, and also the psychosocial support that we offer, in addition to ensuring that we have clear and consistent information provided and good communication throughout the incurable head and neck cancer journey. So some of our takeaway messages from that work is that patient conferences that are organised by patients for conferences for patients were extremely useful forums to be able to engage, and having a physical presence of somebody who is a PPI representative is extremely helpful. Flexibility is key. That for many of our network members, it was only possible to have them engage over the short term, because obviously these people are living with incurable disease, and they may not be well enough to maintain that engagement. And those that have undergone curative treatment also have an important lived experience of this, albeit not with incurable disease, but also they have very, very important insight into what needs to be done. And in the future, we've left it open to include bereaved relatives. And I think for some individuals, they wish to have a say in how that care went and how we can do things better. But this needs a good balance between a proactive approach and a highly sensitive approach to how we might recruit and maintain these individuals. So those are my main points. I hope the rest of the morning goes well. Unfortunately, I can't be with you in person today, but very happy to be contacted if any further information is required. Professor Simon Rogers has my details. Thank you.